Hello, my name is Dr. Jan Philipp Bewersdorf. I'm currently at Yale University, and I was asked to share my opinion on what impacts transplant outcomes in patients with myelofibrosis. So, allogeneic hematopoietic cell transplant is the only potentially curative therapeutic modality for patients with primary and secondary myelofibrosis, and should be considered for all patients who are eligible for this procedure. However, most patients are non-eligible, and transplant-related mortality remains substantial. Myself and a couple of colleagues from Yale and Memorial Sloan Kettering Cancer Center recently published a systematic review and meta-analysis on outcomes of patients with myelofibrosis to help patients and providers make informed decisions where to pursue transplant for myelofibrosis. And in our systematic review, we identified 43 studies with 8,700 patients. And we were able to show that long-term survival at 5 years was 55%, which is significantly better than the natural history of the disease. However, non-relapse mortality remains substantial at 30%. So it always comes down to how do we risk stratify patients for this procedure. And I think the most important factor here remains the DIPS score. And only patients with intermediate to or high risk disease should be considered for transplant, which is in line with current guidelines. Other factors that influence outcomes are age and comorbidities. And then more recently, and ongoing questions in the field remain the influence of paratransplant use of JAK inhibitors such as ruxolitinib, the impact of splenectomy or splenic irradiation prior to transplant to reduce the chance of graft failure. But those were questions that need to be answered in ideally randomized clinical trials and were not able to assess in our systematic review and meta-analysis. And so in summary, I think given the poor prognosis of patients with myelofibrosis that do not receive transplant, and in the absence of curative non-transplant modalities, our results support consideration of allotransplant for eligible patients, but risk stratification and patient selection are essential to optimize outcomes.